Developmental dysplasia of the hip is a congenital disorder that occurs when the hip joint doesn't form correctly. In the normal hip joint, the femoral head should sit firmly in the deep hip socket known as the acetabulum. Hip dysplasia occurs when the acetabulum is shallow rather than cup-shaped, and this means that the femoral head does not sit securely within the joint. This can lead to an either partial dislocation, known as a subluxation, or complete dislocation of the femoral head. The risk factors for DDH can be thought of as the 4 F's. Being feet first or breech after 36 weeks or at the time of birth promotes misalignment of the femoral head. Having a first-degree relative increases the risk by up to 10 times. And in the UK, the presence of either of these risk factors constitutes eligibility for a hip ultrasound scan to check for DDH. First pregnancies are a risk factor for DDH due to increased uterine rigidity, which reduces fetal movement, and female infants due to higher estrogen levels and therefore increased ligamental laxicity. If not treated in infancy, DDH can lead to lifelong problems. This includes musculoskeletal stress and an abnormal walking gait secondary to the instability in the hip joint, chronic pain due to repetitive and persistent dislocation of the femoral head, early osteoarthritis and damage to the joints and cartilage as the femoral head moves inside and outside of the acetabulum, and the increased need for surgical intervention. Therefore, screening for DDH is important because early treatment is the key to a successful outcome. How to check for DDH includes the Barlow and Ortolani manoeuvres. The Barlow test detects whether a hip can be dislocated. It involves flexing the hips and thighs at the midline and applying a backwards force onto the femur. A palpable clunk indicates the femoral head has been dislocated from the acetabulum. The Ortolani test checks to see if a dislocated femoral head can be relocated into the acetabulum. It involves flexing the hips and knees to 90 degrees and applying a gentle pressure on the greater trochanter while adducting the hips to the midline. A palpable clunk suggests a dislocated femoral head has been relocated back into the acetabulum. A palpable clunk during the Ortolani or Barlow manoeuvre means a hip scan will be required to confirm DDH.